So there, perfect.
There
Perfect.
we go.
You look and sound great.
All right. Thank you, Laura. Well, today we're going to talk a little bit about medical deferral, how to avoid it, and what to do if you can't avoid it. We'll talk about, first of all, what is medical deferral. Secondly, how to avoid being deferred. And three, what to do if you can't avoid a deferral. So first of all, what is a deferral? Well, when you're identified as having a significant medical condition that could cause sudden or insidious incapacitation in the cockpit, that's grounds for deferral. The FAA determines that further investigation is necessary to determine your medical fitness to fly. And that's what it's all about. Can I safely fly with the medical condition that I have? That's what the FAA is going to try to determine. And it's a good thing to determine. The FAA's medical division, or CAMI, the Civil Aerospace Medical Institute, will review your AME's physical and examination and the comments that your AME puts in the physical. Then they'll send you a letter and they'll let you know what additional studies and or records are required for them to make a decision on your medical fitness to fly. Now, this may require studies that your physician may not feel to be medically necessary. And we run into trouble here because CAMI feels that it's aeromedically necessary to determine your fitness for flight. Now, the catch with all this, well, there are a couple of catches. Number one, your doc may say, "Oh, I don't think that's necessary," and not order it. Well, you've got to. The FAA wants to see it. And secondly, your insurance policy may not cover this study. You know, they're always looking for things to deny or defer. So it may cost you some bucks. Also, the deferral process may take several months to even several years. Occasionally, these things haven't really been drawn out. So it's going to be some time before you're going to be able to get back in the cockpit if you are deferred. So, how can you avoid a deferral? Well, probably the simplest way is to stay healthy. Now, most illness is a subtle interaction between genetics and environment. You can't choose your parents, but you can choose what you do in your environment. So you want to avoid smoking. That's obvious. Don't stand out in front of oncoming trains. Avoid excessive alcohol intake. It's also a good idea to exercise regularly. And, medical studies have shown that you don't have to do much to stop being a couch potato. About 20 minutes of exercise twice a week usually does the trick. You want to try and keep regular sleep hours. That can have a profound effect on your health. And also watch your weight. If you are starting to become obese, you are going to run the risk of developing obstructive sleep apnea. Every time you get a flight physical, whether you know it or not, your BMI or basal metabolic index is measured. It's basically a ratio of height to weight. And if your BMI gets above 35, that's going to attract the FAA's attention. As a matter of fact, there's a little screen that your AME has to fill out if your BMI is greater than 35, stating whether he thinks you're a candidate for a sleep study. If you fall asleep during the physical, he'll probably immediately defer you to have your OSA treated. Because when you get to that weight level, there's a very, very high probability that you may develop obstructive sleep apnea and fall asleep on short final, and we know that's a bad thing. Sometimes, though, in spite of your being a good Boy Scout and doing all you can to be healthy, you can develop certain medical conditions. Fortunately, a number of years ago, the FAA came to the realization that there are a number of medical conditions, when they are well controlled, that are not necessarily disqualifying. And they invented a process called a CACI, or condition an AME can issue. A CACI allows the AME to issue a medical certificate immediately if an airman can meet certain conditions and, in consequence, avoid a deferral for what would otherwise be a disqualifying condition. Let's take a look at how this works. First of all, these are the list of CACI conditions: arthritis, asthma, bladder cancer, breast cancer, and so on. You can read them for yourself. And if you develop something that you think might be a CACI condition, you would want to see, number one, if it is, and that's really pretty easy. If you can pull up that list of CACI conditions, great, click on it. It'll take you to the CACI worksheet. Usually, though, if you just Google FAA CACI and put in the condition that you have, let's say hypertension or coronary artery disease or what have you, it will usually lead you to the CACI worksheet. Click on that, bring it up, and see what the PDF for that particular condition reads. Let's take a look at the CACI worksheet for hypertension. It's probably the most common one that we deal with. And it states that you have to come in with a clinical progress note from your doc that was done within 90 days prior to your AMA exam. And it has to state that you are without any symptoms from your high blood pressure and that you don't have any side effects from your medications. And also, it lists the medications that are acceptable, that don't cause, basically, medications that don't cause central nervous system aberrations, which obviously are not real good when you're in the cockpit. So if you're on an acceptable medication, and frankly, most of the modern antihypertensives fall into this category. The old antihypertensives that have been abandoned pretty much had some pretty nasty side effects, but most of what is prescribed today falls into the AOK category. So if all of these criteria are met, then you'll get your certificate. And this is what the AME has to review. First, the treating physician or the AME finds that the condition has been stable on your current medicines for at least a week and no changes are recommended. Check yes. Symptoms, none. Blood pressure in the office has to be less than 155 systolic and 95 diastolic. The systolic pressure is your peak pressure when your heart is squeezing blood through your system. The bottom or diastolic pressure is that when the heart is resting. So your peak has to be less than 155, your resting pressure less than 95. Now, mind you, these are not real good figures for a guy to have. And and the FAA selected them knowing that your blood pressure goes up every time you have a flight physical. It's not a typical reading. But if your blood pressure is high, and what is high? Well, it used to be 140 over 90. The American Heart Association is thinking that maybe 130 over 80 might be a better goal. Be that as it may, talk with your doc. And if your blood pressure is above these figures, you should have it checked again in a more representative environment. And if it's still elevated, then you want to get treated. You really do. There are a lot of really excellent medications available. They don't cause side effects. The FAA is good with them. You can take them, you can fly, and you'll not get complications of high blood pressure. So, as you see down here, any one of three different antihypertensives can be used, and your doc will know what they are. And you shouldn't have any side effects from the medication. So, if all of these can be checked off, yes, then you can say you have CACI qualified hypertension and your AME can print up a medical certificate, hand it to you on the spot. You don't have to go through a deferral process. If you're not meeting these criteria, then you're going to have to be deferred. You're not CACI qualified for hypertension. And the same process would be gone through for any one of the 26 different conditions that are currently listed, and the list increases with each year. So for a first or second class medical, your CACI has to be renewed every 12 months. For a third class medical, it would be renewed at the time of normal renewal of your medical certificate, and that would be 24 months if you're under the age of 40, 60 months if you're under the age of 40, 24 months if you're over the age of 40. So, basically, these are intervals that you would want to see your doc for your medical condition, even if you were not getting a an airman's medical certificate. In other words, these are really quite reasonable requirements for good health monitoring. I don't think that any of these CACI requirements would be considered excessive just for the maintenance of good health. So what happens if you don't if you don't meet CACI requirements for your medical condition, or if you have a medical condition for which there is not a CACI? Well, you must be deferred. If one, your condition does not meet CACI requirements, or two, if there's not a CACI for your medical condition. And this is going to require further evaluation. So what happens next? In 2 to 8 weeks, you'll receive a letter from CAMI, the Civil Aerospace Medical Institute of the FAA, telling you that they need further information to determine your eligibility for a medical certificate. Read it very carefully. There's a lot of boilerplate in these things, a lot of technical terms. It's hard to read, but read it carefully. If you have any questions as to what it's saying, you can contact your AME or your own family physician, and start collecting all the medical and or court records that they ask for. If you're deferred for alcohol abuse and DWIs, you want court records. You want to take a copy of the letter that you get from CAMI to your doctor and get whatever studies they ask for. Even if your doctor doesn't think they are necessary, the FAA does. So get them. Uh, I've seen guys that walked into their cardiologist and he said, "Well, I don't think you need a angiogram." The FAA does, and they're not going to give you a medical until they get that angiogram. So please, please tell the doc, "Hey, I know you don't think it's necessary, but the FAA does." Now, there are a number of conditions that are for absolute sure going to require that you go through the deferral process. They include a lot of different heart conditions, diabetes that requires insulin, disturbance of consciousness without an adequate explanation, epilepsy, and various psychiatric conditions such as personality disorder, psychosis, substance abuse, or dependence. So the FAA will grant a special issuance for the majority of these conditions if they are well controlled, but they still will be very closely scrutinized. So prepare to get all the studies asked for, prepare for it to take time and probably some money too. So if you have a condition requiring psychological evaluation, this is going to require a pretty extensive evaluation. They include bipolar disorder, personality disorder manifested by overt acts. In other words, if you uh, have, if you decide you're going to buzz your girlfriend's house repeatedly, if you have a psychosis, substance abuse, or dependence, attention deficit hyperactivity disorder, attention deficit disorder. This is one we run into quite a bit. And, more often than not, what happened is when you were a kid, you were an active kid, and your mom brought you into the local doc. The local doc said, "Oh, maybe he's hyperactive. Let's try him on some Ritalin." You're put on Ritalin. It didn't help much. You stopped it, but you got the diagnosis of attention deficit disorder. That's unfortunately going to trigger an extended evaluation, as will depression or anxiety other than acute situational anxiety. So the FAA has to exercise due diligence for these conditions. And it can be time consuming and it can be expensive, but they have to do it. And you might ask why. Well, one episode that really altered the FAA's thinking on this was Germanwings Flight 9525 several years ago. You probably heard about it. It was a flight, a scheduled passenger flight, an Airbus 320 from Barcelona to Dusseldorf. And its crash was deliberately caused by the co-pilot, a chap by the name of Andrus Lubitz. He'd previously been treated for severe depression with suicidal tendencies and declared unfit to work by his psychiatrist. Lubitz kept this information from his employer, Germanwings, and instead reported for duty. Now, Germany has some very strict confidentiality laws, which prevented this condition being reported to his employer by his psychiatrist, even though the psychiatrist thought he was not fit to sit in the cockpit. And his psychiatrist was proved to be correct because shortly after reaching cruise altitude, and while the captain was out of the cockpit, he went to the restroom, Lubitz locked the cockpit door and he set the autopilot to fly downward in a controlled descent into a mountain in a remote region of the Alps. It impacted at about 6,000 feet, and fatalities included passenger and crew members to the tune of 150 souls. This is the flight path. As you see, levels off at 380, engages the autopilot, and down into the mountain. So that is why, if you do have any sort of psychiatric diagnosis, you are going to have some pretty extensive evaluation. It's probably going to cost you a couple of $1,000 or more. So you have to ask yourself, do you really want to do this? Do you think you're okay, such that you will be approved? If you are okay, you'll get your certificate, but you're going to have to go through all of this evaluation. Now, sometimes, as I said, you will get denied after going through all of this. And most commonly, the reason for denial is that you didn't do what the FAA asked you to do. You got a letter, you need that angiogram, you didn't get the angiogram. They don't have any choice. They have to deny you. Less commonly, if you're denied and you really send in all the information that they asked you for and they deny you, you really shouldn't be flying. Your medical condition is likely to result in you and or your passengers being killed. Your application will be denied. And frankly, the FAA is probably doing you a favor. You won't think that, but if you're denied after a complete evaluation, you really shouldn't be in the cockpit. Of all the airmen who are deferred, though, who did submit their studies and records, well over 95% received their medical certificate under a special issuance. So what's a special issuance? Now, and we'll talk about that in a little bit, but you might get a letter from the FAA that says you're denied, but you're not really denied. Now, previously, when you were denied, that was it. It could only be reviewed by the National Transportation Safety Board in a quasi-judicial format. In other words, you had to get a lawyer, you had to schedule a hearing, you had to argue that the FAA got it all wrong and really are fit to fly. And most of the time, you go through all of this, you spend a bunch of money, and the NTSB upholds the FAA. Recently, however, about the last 6 months, CAMI has started to use the term denied when they really mean give us some more information and we'll further consider a special issuance. Now, I'm not privy as to why they're doing this, but I do know that you have to read this denial letter carefully. And if they say, but if you do this, that, and the other and send it in to us, we'll reconsider. So it really is not a absolute denial, but a conditional denial. It's most commonly seen in deferrals that would require extensive and expensive testing and evaluation. And these usually are cardiovascular conditions or psychiatric conditions where most of the time insurance is not going to pay for the studies. So I think the FAA is trying to say, hey, if you really want to be considered, you're going to have to spend bucks. It's going to take time. So think about it. So bottom line, carefully read any letter that says you have been, quote, denied, unquote. What are they looking for to reconsider? And are you willing to put in the time and the money to do this? If you say yes, you'd better call up your insurance company and find out what they're going to cover and what they're not going to cover so you know what you're going to be getting into. All right, so let's talk a little bit about special issuance. Let's say you did all of your studies, you got uh, the stuff that they're asking for, you had your medical evaluation for this purpose, and a special issuance is usually granted for a specific validity purpose. Usually it's 12 months, not always, but usually 12 months. It's issued to an applicant who does not meet established medical standards, as we said before, and the applicant must demonstrate that the duties authorized by the class of medical certificate applied for, they can be performed without a threat to public safety. In other words, without killing yourself or your passengers. So what happens with an SI? First of all, the AMA will perform an examination. Your application is deferred. In other words, you don't get your medical certificate. It's sent to CACI or your regional flight surgeon for further evaluation. And several weeks later, and this may be anywhere from 2 to 8 weeks, it's with what's been going on in the federal government over the past few months, it's taking longer. So within several weeks to several months, you'll receive a letter from the FAA specifying what records and or tests need to be done for them to determine whether or not you can safely fly. So you obtain the medical records, as we said before. You see the docs they want you to see, get the evaluations they want, tests, and you send them to the FAA and you wait. How long is it going to take? It varies tremendously depending on the condition you have and how many folks are ahead of you in the line. So you'll get a letter then, which will either one, ask for more stuff, or two, they will send an authorization letter containing a time-limited medical certificate, and it will also specify exactly what you have to do to keep it. And this usually involves an AMA-assisted special issuance. What the heck's that? An AMA-assisted special interest is a process that allows your AME to reissue your medical certificate under the provisions of the special issuance. And for this to work, you have to remember, of course, to bring your SI letter to each subsequent flight physical. This is especially true if you're changing AMEs. Now, normally, we will get copies of all of the letters that are sent to you. And this includes your special issuance letter. But if you go to another AME, say you move, the guy won't be able to see you for 6 months, or you don't like him, or whatever. You have to bring this SI letter to your new AME because he or she is not going to know that you're on a special issuance unless he pulls up all of your past medical records and reviews them before you come in. And believe me, for a busy AME, that's rarely done. So the FAA provides initial certification. Authorization letter is going to specify the information the treating physician has to provide for reissuance. The AME may reissue a medical certificate under the special issuance if the applicant provides the medical information required. So that's why you've got to bring in that letter, not only to your AME, but also to your treating physician, so he or she knows exactly what has to be done to allow your AME to reissue. And mind you, the AME's decision is subject to review. So even though he might write or she might write a medical certificate for you, the AME still has the right and the ability to say, hey, wait a second. So before your flight physical, as we said several times, bring your special issuance letter to your treating physician and to your AME. Make darn sure that all the tests that the special issuance asks for are done. and bring all the test results and all the physician statements requested to your AME. Now, this may sound a little complicated, but it's your responsibility. If you want to fly, it's your responsibility. It's not your treating physician's responsibility. It's not your AME's responsibility. It's not the FAA's responsibility. It's yours. So hang on to that special issuance letter, read it carefully, make sure that your treating physician reads it and that he or she does what it asks for. Bring all that stuff into your AME, and that will enable him or her to make a decision as to whether or not he or she can reissue your medical. Now, you may not need an examination from your AME, depending on the class of certificate you're requesting. If it's a first or second class, yeah, you probably will have to get an examination. If it's a third class, and we know those, if you're over the age of 40, are good for 2 years, but if your SI requires reevaluation at 12 months, you can bring in um, all of your reports to your AME. He'll review them, and if it looks okay, he can issue your certificate without an examination. You come back the year after that, 24 months after your last exam, and yeah, he'll have to do an exam in addition to reviewing all of the material you need for your special issuance. If you're under the age of 40 and you just need a third class every 5 years, obviously you can repeat the no exam thing at 2 years, 3 years, and 4 years. Then on your fifth year, you'll need a complete physical from your AME in addition to review of the material that you need for your special issuance. So what's the bottom line to all of this? Unless you're really and truly sick, and I mean, you know, just no business in the cockpit, and you jump through all the hoops that the FAA requires, you can fly. You got to stick with it. You got to do what your SI asks you to do, but you can fly if you do. All right, let's turn it over for questions. Laura?